Edo state government don't take serious steps to fight drug abuse wahala as them don inaugurate state and local government drug control committee. The event wey shele for New Festival Hall Government House Benin City see Deputy Governor Right Honorable Dennis Idausa wey represent Governor Monday Okpegolo administer oath to officially inaugurate the committee, and local government chairmans dem from across Edo State all show face for the inauguration. The move na clear sign say government dey ready to protect youth and promote healthy society wey no dey depend on drugs.
I, your name. Do hereby solemnly swear that I will faithfully execute the duties of a member of the State and Local Government Drug Control Committee, and I will do my best of my ability to promote the welfare of our community and combat the drug problem in our society. So help me God.
Deputy Governor Right Honorable Dennis Idausa for him talk come here and say the inauguration a big milestone for Edo State. He come explain say drug matter don't turn heavy problem for society, and this new committee go follow the National Drug Master Plan to stop drug trafficking and drug abuse.
I'm here to represent my principal, the Executive Governor of Edo State, distinguished Senator Monday Okpegolo, who is unavoidably absent. Hence, he has asked me to represent him and to deliver his speech. Address by His Excellency, the Executive Governor of Edo State, Senator Monday Okpegolo, at the official inauguration of state and local government drug control committees held on Friday, October 3rd, 2025. It is with great joy and deep sense of responsibility that this significant committee is being officially inaugurated in our state today. This gathering marks a vital step in our unwavering commitment to addressing the scourge of drug trafficking and abuse that threatens the fabrics of our society. I am particularly glad that Edo State has taken this bold initiative in compliance with the National Drug Control Master Plan. Drug trafficking and abuse represent a complex challenge affecting individuals, families, and communities. They contribute to the rise of crime, violence, and social instability. The committee will develop strategy for drug prevention, provide education and awareness on the danger of drug abuse, and deepen collaboration with relevant stakeholders in making the state free from drug and substance abuse. All members have been carefully selected, and their acceptance to serve is highly appreciated. Their expertise, dedication, and passion for building a better future for our state will be pivotal in steering our efforts towards success. I call on NDLEA to continue its onslaught against drug trafficking cartels. In addition, I urge our educational institutions, religious organizations, and civil society groups to join us in this fight. The ultimate objective is to ensure that every child in Edo State has a brighter, drug-free future ahead of them. Together, we will prevail over drug and substance abuse. God bless you all. God bless Edo State, and may God bless the Federal Republic of Nigeria.
Assistant Commander General of Narcotics Fidelis Kokodia, wey represent NDLEA HMO Brigadier General Mohammed Buba Mawa retired, come here and say the agency dey focus on grassroots awareness, outreach programs and support system to help people wey dey depend on drugs. NDLEA Edo State Commander Mitchell Ofoyeju come drop numbers wey show say Naija drug use rate dey 14.4%, but Edo State dey higher with 15%. He come describe the situation as worrisome, say the availability of drugs don lead many youths into crime and violence.
It's a thing of joy to see that Edo State is blazing the trail in Nigeria. What we're about to do today is actually one of the recommendations of the National Drug Control Master Plan. And Edo State is the first in Nigeria to have both state and local government drug control committee in place. Other states only have state drug control committee. So, His Excellency, thank you for this bold step. By way of introduction, the inauguration of this committee represents a significant milestone in the history of drug control in Edo State. The data of drug prevalence which we have states that Edo State is slightly having a drug prevalence higher than the national. At the national, the drug prevalence is 14.4%, which translates to about 14.3 million Nigerians who were said to have used drugs in 2018. But in Edo State, the percentage is 15, which translated to about 330,000 persons in Edo State. So to us, it is very worrisome. And the impact on public health and safety is something that we do not want. And the key concerns are that youth vulnerability. As you are aware, growing up, they are exposed to so many things they want to experiment. So another concern is the availability of drugs, because if there are no drugs, there will be no abuse, while another is increase in crime. Now, what are the objectives and responsibilities of these drug control committees? Number one, they are to enhance coordination of drug control activities. They are also to be involved in policy development. They also conduct community outreaches, and of course, they will do monitoring and evaluation in order to track effectiveness of drug control initiatives. Now, community involvement is a notable aspect of the committee which deals with community involvement and grassroots participation. And we are happy that all local governments in Edo State are here represented. Now, what are the expected outcomes? Number one, we expect that there will be improved public health and safety. Number two, we expect an elevated community resilience against drugs. We also expect enhanced enlightenment on drug abuse and, of course, difficulty in assessing the substances of abuse. More outcomes include increased disruption, and this will be facilitated by the intensified raid operations. We're also going to make drug trafficking unprofitable for the drug traffickers. We are going to prevent drug use and ultimately provide quality treatment and rehabilitation to persons with drug abuse disorders. In conclusion, this is a bold step by the Edo State government towards creating a safer and healthier communities.
What I'm about to read now is a goodwill message from Chairman Chief Executive, National Drug Law Enforcement Agency, Brigadier General Obama, retired, but not tired. He's unavoidably absent. I've been briefed. He's in New York, the UN Assembly going. So the words are his words. I may see me physically, but my chairman is here with us in spirit. Today marks a significant milestone in our collective fight against the scourge of drug abuse and trafficking. a battle that requires the concerted efforts of all stakeholders within our communities. The creation of these committees is a reflection of our shared commitment to fostering a safer and healthier environment for our citizens that is free from the devastating impacts of substance abuse. The challenges posed by drug-related issues are multifaceted, affecting not only individual users, but also families, communities, and our nation as a whole. It empowers stakeholders to collaborate, share insights, and develop tailored strategies that reflect the specific needs of our communities. I urge each member of these committees to approach their roles with dedication, empathy, and a spirit of collaboration. Your work will not go unnoticed as it lays the foundation for a holistic approach to drug control that encompasses prevention, treatment, and rehabilitation. The establishment of the Edo State Drug Control Committees presents us with a unique opportunity to tackle these challenges at grassroots level. It empowers stakeholders to collaborate, share insights, and develop tailored strategies that reflect tailored and pragmatic strategies that reflect the specific needs of our communities. Let us also remember that our journey is not just about enforcement. It is about education and prevention. We must engage our communities in dialogue about the dangers of drug abuse, focusing on the youth who are particularly vulnerable. Awareness campaigns, community outreach, and support systems are essential components of this initiative, and I encourage you to be innovative in your approach. I would like to express my sincere gratitude to the Edo State government, specifically His Excellency Senator Monday Okpebholo, and all partners involved in bringing this initiative to fruition. Your support has been pivotal in our collective efforts to curb drug abuse and trafficking.
Edo Commissioner for Health Dr. Cyril Shombole for in part compromised the ministry go join hand with NDLEA to make Edo a model for drug control. He also emphasized rehabilitation, enlightenment, and giving youth second chance for life. Coordinator Office of the First Lady Edesili Okpegolo Anani can describe drug abuse as pandemic for Edo State and say almost every crime gets drug connection. She come out say women must join the fight sake of say mothers get natural way to appeal to pikins them, make them leave drugs.
Drug has become is it an epidemic or a pandemic now? I don't know. It's a pandemic, yes. It is really eating up our youth. And I say that drugs and crime, they're interwoven. You hardly see a crime that the person is not on drugs. It's really, in the office we have a lot of people, lots of cases, and most times you find out the people are on drugs before these crimes are committed. We'll have a murder case we're working on, the guy murdered his girlfriend, and he said they were high on drugs. You have people that were girls that are being raped, they were all high on drugs. But then again, in this room I see that we're all mainly men. I don't know where, Commander, you didn't give us a lot of women representation. And we know that in our fight against drug abuse, the women have to be on board as well. They are the forerunners of the society, the forerunners of the home. They are people that have more empathy. The women come in where the men cannot really step in. They have more empathy and sympathy. They speak to the hearts of the children. A mother will appeal, a mother will beg, a mother will cry, a mother will do everything to make sure that that child, for those of us that are Christians, the Bible says Jesus will leave the 99 in search of one. That's who a mother is. So I want to commend, I want to appeal that we have, more women representation when we're dealing with drugs. The men are the ones that have the voices to say, if you don't stop drugs, you don't stop drugs. But they're doing a great job as well. The last meeting we had with the retired chairman, the chief executive, retired General Mohammed Bubamarwa, he said to us, it's a tax that must be done. All hands must be on deck. We should get rid of this menace that we face. And he further went on to say that he would recommend that before you get married, both couples should be tested for drugs. Yes. So it's not just HIV, it's not just the genotype, but they should be tested for drugs. According to him, he said he has a family friend that the husband murdered the wife, and then they realized that he was high on drugs. So it will also be fair and good to preserve our daughters and our sons when they get married. I had an experience myself. Went to the hospital, National Hospital, and then they rushed in a man, and his intestines were out. I rushed him to the emergency ward, and I heard the sisters saying that, okay, they were saying this in Hausa, because I had to speak Hausa a lot. They have been telling this man that this woman, talk to this woman, these drugs will kill him one day, these drugs will kill him, and today look at where they are. I really don't know if the man made it, but I hope he did. So today, I'm just here, just a brief remark to say that the work is not just for His Excellency, the work is for all of us. Today, we're all ambassadors of His Excellency, preaching the gospel of free drug society. The commissioner sent me a video, I think yesterday or day before yesterday of health. I think it's a video about certain people that were high on drugs, and it was very pathetic. That video stuck in my head for a couple of days. It's a shame. Honestly, it's a shame. Everybody's been high, and then as I always say, the songs we listen to also affect our children, influence them, I mean. You hear them singing, we're high on codeine, we're high on, is it ice? We're high on everything, and they portray a life that looks pleasurable. As I've always said, that drugs is actually the highway to destruction. So thank you so much for coming. I just want to plead with you that whenever we call for our meetings, please make yourself available. Please take the message to all the local government chairmen here. In fact, I heard that Auchi is worst hit with this drug issue. Anybody from Auchi? Am I correct? Yes, I saw a video. I heard Auchi is hit with it. Please, I want to plead with us that we take this message to the local level, and let's come up with programs. Let's do a lot of sensitization. Let's do a lot of radio adverts. NOA should be here. Information Minister also should be here. Commissioner of Information should be here. Let's spread it everywhere, let everybody hear. So there's no excuse.
I stand here today deeply honored to be nominated and sworn in as a member of the State Drug Control Committee. This is not just an appointment, it is a call to service at a time when the challenges of substance abuse, drug trafficking, and their devastating impact on public health and security demand urgent, coordinated action. Your Excellency, sir, let me begin by appreciating your visionary leadership in strengthening institutions that safeguard the lives of our people. I also commend the Nigerian Drug Law Enforcement Agency under the distinguished leadership of its chairman for its relentless commitment to protecting our nation from the scourge of illicit drugs. As a medical doctor and public health advocate, I am actually aware of how drug abuse undermines not only individual lives, but also families, communities, and the overall development of our states. The health consequences, the social disintegration, and the economic burden are far too heavy to ignore. With this mandate, I pledge my full commitment to working with the fellow committee members, the NDLEA, and all relevant stakeholders to ensure that Edo State becomes a model in drug prevention, control, and rehabilitation. We will prioritize public education, especially for our youth, strengthen enforcement collaboration, and support rehabilitation progress that give victims of drug abuse a second chance at life. Together, under your guidance, Your Excellency, we will build a healthier, safer, and drug-free Edo State.
With this new committee, Edo State don show say the fight against drug abuse not be only government matter, but na collective effort wey go bring better tomorrow, protect youth and secure healthier society. Make una no forget say, as we see am, na so we dey talk am. We no dey take blame. Ekata Ojesele, TMC News.